Hi, everyone. Rob from Two Docs Talk, joined by my co-host Abbass. Today we have Dr. Ladan Harari. She's a board-certified psychiatrist licensed in California, specializing in women's mental health. She completed her medical training at Creighton University and psychiatry training at University of Southern California, USC. She has served as an associate professor at USC and has held clinical roles at Cedars-Sinai and Providence Mission Hospital, Laguna Beach. She currently provides personalized telepsychiatry care through United Medical Doctors and Results Psychiatry, and she has an interest in premenstrual dysphoric disorder, perinatal mental health, and menopause-related mood disorders. Really enjoyed our conversation with Dr. Harari. We're hoping to have her back for a second episode because there's so much to talk with her about. Also, she's writing a book, and we can't wait to see that. Also, wanted to update everyone on the status of our petition to stop Medicare from limiting access to telehealth coverage. So benefits for telehealth were extended through September 2025, but come October 1st, we're going to be back in the same boat with potentially Medicare beneficiaries losing that coverage unless Congress acts to keep the funding going. Our petition currently has just over 26,500 signatures. Thank you all for participating in that. And if you haven't signed it, we'll have a link in the show notes. And please share it. We're trying to get up to 50,000 signatures, and we're going to keep on this, asking Congress, asking your elected officials to support this benefit as it's so important for rural and homebound patients. Without further ado, here's our conversation with Dr. Ladan Harari.
My name is Abbass Shafiei, and I'm here with my colleagues and friend, Dr. Rob Hoyer. We're very excited to have this episode. It is a very common problem, but very little talked about, particularly in internal medicine. And so we are so excited to have Dr. Ladan Harari with us. She is a psychologist. She's interested in women's health, and we are so excited to have her here with us today. So today we're going to be talking about postpartum depression. And I know my wife suffered from that, and it took a little while to find out, but so excited to have you here, Ladan. Could you tell us a little bit about yourself and what made you interested in women's health and especially in postpartum depression?
Yes, thank you so much for having me on today. I appreciate it. I am so excited to talk about this topic I'm very passionate about. So, I actually fell into it by accident. When I was in residency at USC, I had the opportunity to do the women's wellness track. That's when I thought that I wanted to do child and adolescent psychiatry. I didn't end up doing that, but I was exposed to maternal wellness and got to learn more about postpartum depression and anxiety and how it affects our patients. But I'm going to be completely honest. I really didn't understand. It's different when you're on one side of it, and then when I had my beautiful little boy back in 2020, I was a COVID mom. I actually suffered pretty severe postpartum depression and came to learn that there are very few safety nets for mothers. And I became very passionate about that. And when I started my concierge practice, I really put my focus on maternal wellness. There's very few maternal wellness psychiatrists that feel comfortable taking care of pregnant, postpartum, breastfeeding moms. So I've made it my mission to try to get the information out there and advocate.
Could you define what is postpartum blues compared to postpartum depression and some of the mechanisms? I know it's kind of not really well known. What exactly is this condition? If you could describe what we know.
Yeah. So, and that's the thing. We have all these terms, and what I actually noticed in my own personal experience and also from taking care of my patients is that there's a lot of cutesy names that we use to label a woman's status once she gives birth. So if you think about it, I always say when you give birth, you die and you're born again, and you lose the person that you used to be, and you are now a new person. And with that comes a massive loss of fluids, major fluid shift in your body. And then most importantly with that, then you have a major shift in the two major hormones, good old progesterone and estrogen. And that tends to be where we see postpartum depression born. Now, we call baby blues the first 2 weeks, and we tend to normalize baby blues, which I have very personal opinions about, and I can go into that. But pretty much, what's the difference between postpartum depression and baby blues and regular old depression? Really, they're all one and the same, and it's more so a timeline. So typically when we say someone has major depression, they're having issues with sleep, either sleeping too much or not sleeping enough. They have very little interest in activities or things that used to make them very happy. They have feelings of guilt, like they're not enough, or very self-conscious of why they're even here, or guilty that they even exist. Low energy levels, poor concentration. They can't eat. They can't seem to move right. For a lot of patients this either they feel like they're like this 1,000-pound boulder, and it's so difficult to move their body. Or for some other patients, it's that they're so jittery and that they can't sit still. And then in the most severe cases, then we can also see thoughts where patients have thoughts of wanting to harm themselves. So with, good old depression, we see that across, males, females, all ages. And then we define postpartum depression as those symptoms coming about for 2 weeks or more within the first 12 months of giving birth. Now, that's kind of weird that we call it just within the 12 months, because actually what the newest studies show is that it takes 6 to 7 years for a female to actually recover both physically and mentally from giving birth. So, if I have a woman that comes in and says, I have a 5-year-old and I've been struggling with depression, it's like, I'm still going to call it postpartum depression. I'll be honest with you, because if the symptoms really started after birth, then that's what we're going to call it. Baby blues is going to say that you're having these feelings within 2 weeks, and it's, less than 2 weeks. And sometimes it's more just like a couple days. It's kind of a cutesy term, in my opinion. A lot of times I actually see I used to do consult liaison psychiatry, where I was actually taking care of patients in-house. Baby blues to me looks more like a mild delirium, where the mother is like kind of detached from reality. They're really sleep deprived. So there's a lot of terms that kind of get thrown around, and it's really mostly based on timeline.
And there's also postpartum psychosis. I assume that is the severe cases. Is that correct?
So scary. So that's the thing, postpartum psychosis. And like, if there's one thing for listeners, whether you're a clinician or you're a patient or you're a family member to take away from this podcast, is if you see that the mother is actually detached from reality and she's having any sort of first rank symptoms of psychosis, for instance, feeling very paranoid, hearing things, seeing things other people can't hear or other people can't see, and really, really detached perceptually from reality, that's postpartum psychosis. That is a terrifying state for the mother to be in. And really the biggest concern is the safety of the child. So that's where you go to the emergency room or you call 911 immediately, because that mother is probably not going to be disclosing a lot of what's actually going on in her mind. It is very difficult for me to be convinced to let a mother go home when she comes into the emergency room or she comes into my clinic when she has postpartum psychosis. It's like, nope, we got to get you in. We got to fix this before you can, be with the baby, because that's where the really tragic stories happen.
And it's not only affect the mother, it affect the child as well, and sometimes the family. Is that correct?
It's so hard. And it's so hard on the families, because, when you have a baby, the whole world is just like, it is turned upside down. At least for me, it was when I was a COVID mother. And everyone is so worried about the baby. And a lot of times they forget about mom, right? And the really hard thing for the baby is, especially within that first month, there's so much happening in terms of the baby just came out into this world where it's cold and it's loud and there's lights everywhere. And then the mother's not able to actually attach or bond with the baby. And that can have some serious implications on the child's development in terms of being able to hit those milestones, in terms of being able to just be a well-regulated child and adult. So that's why the sooner you're able to catch those symptoms and seek treatment, the better.
Maybe could you go over some of the risk factors for these conditions?
Absolutely. So, and when we look at risk factors, again, it's a spectrum, right? So, a lot of times what we see is a mother coming into pregnancy and she has a history of depression and anxiety. Maybe she's been on medication before, maybe she hasn't. Maybe she's been going to a therapist, maybe she hasn't. But that tends to be a big one is, clinicians, please always ask your patient, do you have a history of depression? Do you have a history of any sort of mental illness in your past? Does your mother have any history of having had postpartum depression or any sort of mental health issues? Either, again, it always ticks up your risk factor if it was within the postpartum period. It also kind of helps to look at the mother's mother, so grandmother, right? And see if there were also any major mental health changes that came about with menopause. Because that tends to tell you, oh, this is a hormonal related issue potentially. So, those tend to be my biggest risk factors for patients. Is if you've had it, then I have to keep an extra close eye on you. Another major risk factor is, again, the lack of social support or the lack of even like financial resources. So how often are you going in to see your doctor? How many people are in your support network to keep an eye on you and make sure that you are doing okay after the birth period? If you do have, someone to take care of baby while you go and catch a couple hours of sleep. Also nutrition. So I have a lot of patients, we live in beautiful Orange County here, and I tend to have a lot of mothers that will restrict themselves very, very, very badly during their pregnancy periods. And so then they are nutritionally not optimized for that postpartum period. And then all of a sudden their body is not only trying to recover from giving birth to a human, but is also trying to lactate to feed that human. So then again, it's like we are only so much. And if you're draining and draining and draining your body, something's got to give. So those tend to be the top risk factors that I see in my patients that come in with postpartum depression.
What about substance abuse, like alcohol, casualty or drugs? And I'm sure that's plays a role as well, especially young mom.
Absolutely. And it's I'm so happy that you asked that question. I did residency at USC, like I mentioned. So the LA County population, we had a lot of substance abuse in the patient population. So, you look at things like methamphetamine, cocaine, alcohol use, all of those things, whether you're going to be postpartum or not, they're going to set you up for a lot of mental health issues. But the other really, really interesting twist is also patients that say have bipolar disorder or had depression and they were on medication, and then they will go to their OB-GYN, and OB-GYN says, oh, congratulations, you're pregnant. You can't be on any medication. And they stop their medications cold turkey. And I really, really, really want to make it clear that, yes, there are certain medications that are very big contraindications to pregnancy and breastfeeding, but there are actually a lot of medications that are not a contraindication. Some of them also fall within the gray zone. That's an important discussion to have with your physician in terms of risk and benefit ratio. But as it is, a lot of my patients that come in, and even if they're not pregnant, but maybe they're planning to be pregnant and they say, I need to be on something that is definitely pregnancy safe. And I have some goodies in the drawer that, we can talk about and make sure that you have confidence being able to get pregnant while still maintaining your psychiatric health.
What's the best thing for preventing some, we know beside the history and all of that, what's the best prevention so that the family and the mother be prepared for this?
Mm-hmm. That's a good question. I would say optimize your village. That is easier said than done. I think, coming from the old country, in our culture, we have a very, very nice village. But in Western culture, and, if you're living in America, the village is very, very limited and sparse. And sometimes you have to pay for a village, right? Which is especially hard in these economic times. I think that the number one thing is really having social support. To be able to have somebody there that you feel comfortable saying, I am not feeling right. I am not feeling the way that I thought I would feel with this baby in my life. Or, excuse me, I am not sleeping. And I think I might lose my mind. And a lot of these things, we just kind of hear them. We just kind of laugh it off like, oh, you'll be okay. Don't worry. Eventually the baby will sleep. And it's important really to have that sounding board and to make sure that family members and support systems know that, it's really exciting when baby comes into the world, but don't forget about mom. And that's the number one thing that happens is we really forget about mom. It's so, like when she's pregnant, it's like everyone wants to rub the belly and everyone wants to, ask is it a boy and girl, and everyone's really excited and very concerned about, when you're coming down the stairs and things like that. You pop out the baby and all of a sudden you pretty much feel invisible. And, a lot of my patients will tell me that. So it is really important to have that social support system. It's also really important to kind of look ahead. I always actually tell a lot of my friends and family members to have appointments booked with a psychiatrist ahead of time. So if you know that you're having baby on the first week of, say, I don't know, May, then have an appointment booked for mid-May that you can attend with a psychiatrist. Most psychiatrists are doing telepsychiatry services such as myself. So, you can either choose to use that appointment or not, but that's a really nice safety net to keep there.
And the incident is a lot more common than people they think. Don't you think so?
Mm-hmm. Absolutely. 1 in 7 mothers actually suffers from postpartum depression. And I think that number is actually very, very inaccurate. I think that the number would have to be a lot higher. It's actually really funny because I was speaking to a friend and she's had 3 babies back to back to back and said, oh, I've been so lucky with these 3 kids. I kept thinking, oh, with this next one, I'm going to get postpartum depression. And I didn't. All I got was anxiety. And I'm like, all you got was anxiety? Tell me more about that. And, she started describing what to me, would be a situation where I would offer her medication if she was my patient. So we tend to minimize a lot of the symptoms and say, oh no, it's totally normal that you hate life. It's totally normal that you're not sleeping at all, even when the baby is asleep. It's totally normal. And it's not totally normal. So, if we can kind of have a shift in advocating that the period of time after having a baby, it can be a very beautiful time. I know for myself, I had such a difficult time with my first pregnancy because, again, it was a COVID pregnancy. I was working 3 full-time jobs during the pandemic, and I didn't even get a single minute off. I was a 1099, and actually, as I was pushing my baby out in between pushes, I was giving admin orders to my nurse over the floor for a patient going from the ER to the inpatient unit. So it's like we normalize these things and we say things like, oh no, I hate it when people say, mama, you got this. Oh no, mama, you got this. You're superwoman. But we're not superwomen. We're women. And we need to normalize the fact that what we are doing is a big deal. Yes, it is very natural to our bodies, but that also means taking time to take care of our bodies after the fact and to be able to say out loud, I'm not doing well, and not have major shame surrounding that.
Could you talk a little bit about treatment, and specifically how does the treatment differ from general depression in a non-postpartum setting?
Absolutely. So again, there's, what we classify, and I use the little air quotes, as pregnancy safe, postpartum safe, breastfeeding safe versus not. And what that really means, if you think about it, how many pregnant women in history felt comfortable being part of a study to determine whether a medication was safe or not? Now, we know that there are definitely certain no-nos. There are definitely certain medications that absolutely pass through the breast milk. So, that's the other question is your patient breastfeeding or not? And I always, empower women, if you want to breastfeed, let's not tiptoe about it. Breast is best. And I know that there was a big movement on, social media, hashtag fed is best, and not to have any sort of shame about using formula. But here is the reality, and I'm going to say it, okay? And if you think this is mom shaming, that's fine with me. Breast is best. So that's the thing, is you're not in a situation where you say, oh, okay, I have to stop breastfeeding. No, you don't, because there are actually medications that we do have ample studies on that show that they actually don't pass through the breast milk, or if they do pass through the breast milk, it's actually in an inactive form, and it's not going to affect baby in a negative way. In fact, what we do know specifically about moms that are pregnant and decide to go on antidepressants, Zoloft being, the goodie, is that babies born to mothers that had those depression and anxiety symptoms during pregnancy that end up getting medicated appropriately, the babies do a lot better. They're less likely to have colic. They're less likely to be anxious. They're more likely to hit their developmental milestones on time versus the babies that are born to mothers that didn't get medicated when they needed to be. I, for instance, had a very colicky baby. And I think about that. I really do think about that. Had I, pulled the trigger and had gone on medication when I was pregnant, which I really should have, then would my baby have not had colic? That would have been nice not to have, a baby literally scream at me for the first, I swear it was like, I exaggerate, but I swear it feels like it was for the first 2 years of his life. And, he didn't sleep very well. That's a whole other topic, the sleep thing, which, by the way, I'm writing a book on. I'm halfway done, so look out for it.
Oh, interesting. Interesting.
I'm really excited. Yeah, babies and
We'll
sleep.
have you after that on so we can talk about it. What about the role of nutrition and hydration? What about the role of hydration and nutrition?
That's a big one. So those big jugs that they give you at the hospital when you come out of surgery? I used to call that my best friend. And I was filling that cup up 5-6 times a day with water, because think about it again, hormonal imbalance and fluid imbalance. So, you may have gotten several IV bags of fluid while you were in the hospital. I know I came home and from my knees down, I looked like Dumbo's mother. Like I had that much fluid in my body. And these fluid shifts had, that to me said, wow, I must have been really dehydrated because, I look back at the records and they had given me like 11 bags of IV fluids. So that that really tipped me over again in terms of my progesterone, my estrogen shift. Now, for simplicity's sake, I'm going to tell listeners out there, if you're going to focus on, supplements and nutritionally dense foods, and again, it also tends to depend, if you're breastfeeding and your baby is really, really sensitive to what you're eating. In my case, I pretty much lived off of vegan bread and water for like the first 6 months of my son's life, because if I looked at anything that had dairy in it, my son's colic would get worse. But what I really was good about, given I couldn't eat very well, and I truly wish that, we had nutritional support, like dietitians and nutritionists that could also, weigh in for mothers. That's very difficult to find too. But magnesium is your best friend. You got to be on a magnesium supplement. Check your prenatal vitamins. Typically my moms, whatever prenatal vitamin that they were on during pregnancy, I just have them carry that out. As long as you're breastfeeding, you need to be on the prenatal vitamin. But look at the prenatal vitamin and see what's in there. Omega-3 fatty acids. That's where I really want you to work with a psychiatrist, because actually how much omega-3 fatty acids is in your prenatal, it's not going to cut it. You want to be above and beyond that. That's going to help with a lot of your mood symptoms as well. One that people don't talk about actually is saffron and turmeric. So saffron, we're very lucky in our beautiful Iranian culture. The Iranian teas, it tends to give you a euphoria. There's a reason for it because of the saffron and the cardamom. So saffron actually comes as a supplement. So, if you can incorporate it into your food and or if you can do it as a supplement intake, that tends to have a very, very nice antidepressant type effect. And turmeric is really nice because it's an anti-inflammatory, which helps a lot as well with a lot of mood regulation. So yeah, if you had to focus, it's going to be your omega-3s, magnesium, saffron, turmeric, and then stick to your prenatal vitamin.
Or Persian food.
Oh, yes. There's nothing that makes me more giddy than some Iranian food. I can't cook it, but I can order it.
Have you heard the 3-5 rules? 5 days in bed, 5 days on bed, 5 days around the bed?
No, I haven't heard of this.
Yeah, well, these are, of course, when my wife had babies, we had a bed, a room next to her. The lady was from Africa, and she was shocked that they come teach mom how to breastfeed or how to take care of herself, because this is because in here, of course, we are not accustomed to there, but the older culture, people, grandmas, moms, they seen the thing. So it is like a routine. Some of the culture, they think that, 5 days, it takes your body to heal from the, uterus contraction, losing fluid, stuff like that. So, and bonding with the baby, the other 5 days, you stay in bed, but you move around, but still is bonding, feeding the baby. Then the last 5 days, you can go around, but still be able to rest enough that your body to recover from that. So this is some of the older culture, but in here, of course, the most they give you 2 weeks off from work, and then boom, you have to go back to.
Not even.
It takes time.
I love that though. That you said it's the 5-5. You said 5-5
5 days in bed, 5 days on the top of the bed. I mean, you can and 5 days around the bed. So it's sort of simplified, but this. But anyway, but if you look at the older culture, of course, from one of my favorite thing when my family has babies is almond soup. That made this special almond soup. So that I would love that because I want to have some of that because it's so tasty.
It helps a lot with it really helps with lactation and also, the reparative process. Absolutely. Yeah, absolutely. And that's the thing, right? I think that, and again, I'll be the first to say it, Western culture does it all wrong. All wrong. All of it is wrong. Very, very blanket statement. Again, my book is actually about how much I disagree with the cry it out method and sleep training, which is a highly, highly profitable business in America. And really, we're the only country that does that. And, what I see is, nutritionally and the time off and all of that. I mean, if you really think about it, it's because society is going to benefit a lot from shoving mom back into the workforce, right? It's a machine. And who gets sacrificed in all that is the baby. And that's why, we say, oh yeah, no, it's fine, mommy, you can go back to work. You can do it all. Daycares are great. Babysitters are great. Nannies are great. No, they're not. No, they're not. And and again, it's very, very controversial that I say this. I know I offend a lot of people when I say this, but I'm going to say it and I'm going to shout it from the rooftops. A nanny, a babysitter, daycare is not the same thing. Even dad is not the same thing. A child needs the mother. And we have enough studies over the years that say so. And when every other culture in the world is saying that, and their kids are a lot more emotionally regulated, far more than ours, there's something to say about that. So I would say all the old wives' tales and the old school rules, they're good for a reason.
Especially the first 6 months. The bonding, the nutrition, the immune system for the baby, probably, as you said, less colicky, less things. So yeah, it is a transfer from one to the next. And as I said, we live in a village. I mean, you got to have to take care of each other because the pain down the line or kicking down there, that the child, more doctors visit, more nutrition, more immune system. So yeah, so it's an amazing topic, and it's so great. Would you like to add anything else to do you have for conclusion?
At the end of the day, mom, you have to listen to your gut. And the only time I've really ever gotten in trouble in my life is when I didn't listen to my gut. And especially, again, when you make that passage from pregnant woman to mother, there is something that happens in you where that gut instinct, it becomes very strong. And if you don't listen, that's when you get in trouble. And once you're a mother, you're not you anymore. And again, this is controversial. Again, very controversial. It's not about you. It's also about your baby. Okay. You were one person for 9 months and you always continue to be one person. Even now, my 4-year-old, I always know when he needs to use the potty because I think I need to use the potty. And I say, do you need to go use the potty? He says, no, I don't. I say, no, yes, you do. I know you do. I can tell you do because we are still connected. So if you're not taking care of yourself, guess who's going to feel it? Your child. So take care, listen to the little voice inside you, ask for help. There is no shame in asking for help. The village includes your doctor. So if your doctor isn't asking the right questions and the doctor isn't listening to you, fire that doctor and go on to the next one. Believe me, there's plenty of us.
I particularly like your comments about the pre-booking of the booking of the physician visit prior to to the time it's needed. I think that's really smart, and I suspect that's the first time I'd ever heard that. Probably a very small percentage of people are actually doing that, but I think we need to get the word out. I think that's a great idea.
I think so, because it should be part of the protocol, don't you think?
It seems like it. Yeah.
I had one more question. What are, in general, just some ABC of lifestyle modification to do in this postpartum time, so before and after? So what are some of the common things that just an average woman can do, just decrease the incidence? Sometimes, of course, the hormonal change, you have no choices, but there's some stuff we can do to prevent that.
Right. So for one thing, stay off of, I think the biggest lifestyle change is stay off of social media, because the minute that you download those pregnancy apps, your social media knows you're pregnant, and it's going to start brainwashing you into thinking you got to snap back. Once you have that baby, you have to start exercising, get this stroller so you can jog with the baby, get this bassinet that rocks your baby to sleep. Get rid of those, because those are a money machine, and it all comes at the cost of your well-being. So no, there's no timeline. You don't have to snap back. Give your body time. I have women that come in and they're like, oh, I've been struggling so much. I haven't been able to go to a Pilates class and this. I'm like, Pilates? You just gave birth to a baby. Get back in bed. What is wrong with you? So you need to be realistic. You can't have your roots done. You won't have your nails done. Just focus on living in your pajamas, breastfeeding the baby, and spending time with the baby and watching TV as you rock that kid to sleep. So that's really the big thing. Another lifestyle change is, again, being able to ask for help and, have family and friends involved, or, maybe paying for the village to come in to help. So outsource things. I don't want you to be Martha Stewart cooking a chicken, and no, frozen foods are fine. Yes, it's not ideal, but you're not going to have time to make fresh cooked meals. If you need someone to come in and clean your house, outsource as much as you can. Paper plates. You don't have time to wash dishes. Maybe you don't have time to do the laundry. Buy some extra packs of socks and boxers for your husband and some extra underwear for yourself, because just let it pile up. So you're not going to be able to get back into the rhythm and be able to take care of your life the way that you wanted to. And feel free to also ask your employer for extra time off. And if you do have postpartum depression or any sort of postpartum anxiety or mental health issues that you're seeing a doctor for, they can extend that maternity leave. It might not be paid maternity leave, but think about it. If you have to make cuts here and there and take out a second mortgage, do what you need to do, but you have to heal before you go back into the world.
Well, Ladan, thank you.
I wish I had done all this when I was
this is going to help a lot of people. This is really smart. So I wish we knew this when we were pregnant. This is like advanced, super AP plus. No one really talks about this. It's all about the maternity classes, all about the kind of the pregnancy and the birth period and that whole thing. And this is all kind of like you kind of jump in there and you're like, oh my gosh, this is totally different than what we had no idea this is coming.
And who suffers is the kids. And then my kid has to play with kids that are dysregulated and total jerks on the playground. It's like everyone suffers, and it's a society problem. So when we look around, we're like, why does society suffer so much? Why are people so mean? Mean kids become mean adults. So do the work early, mom. And the only person that's going to raise that kid to be phenomenal is you. That's the truth. I'm not going to sugarcoat it.
No, that's awesome advice, and I think is so true. I think we're after 30 plus years of daycare, we're as a society realizing what that results in. And you said it's a lot of angry people. It's a lot of the families are fragmented. It's a mess. Yeah,
it's the right investment to do.
Yeah, and you know what? That's why when I go to Home Goods and I see this like merchandise that says like lady boss or girl boss, I just want to smash that stuff because you know what? No, you can't do it all at the same time. You can do it all, but you can't do it all at the same time. So women, moms, everything has a season. So for instance, right now, I only work 1 day a week. And I am very, very grateful that I am in a position to be able to do that, because this is not the time for me to be, this like hotshot doctor. And no, my job is my kid. And I'm teaching my kid his ABCs and 1, 2, 3s. He doesn't go to daycare, none of that. And I'm really, really, really proud that I'm doing that. And I wish that more moms would do that, because the thing is daycare, it used to be, an option that, like if you have to, then you utilize daycare. And now it's become this, your son is not in daycare? What? How do you have time for yourself? I don't have time for myself because my time is for my son. That's the thing is, again, being in Orange County, I have a lot of moms that, they scoff at me that my son is not in daycare, because it is a little bit of a societal flex to say, oh, my child goes to this Montessori or that. And, it's like, ew. It's like, like your kid looks like he's eating his boogers for all that expensive daycare you put him in, But it's like, stay home as much as you can. You can go back to work after your kids are adjusted and old enough. And again, that, I would say that every feminist in the world would want to chop my head off for saying that. But I truly feel like by saying what I say and believing what I believe, I am the true feminist, because I am saying that women, your birthright is to be a mother and to also enjoy it. And there is nothing more enjoyable than being able to raise your own child. It's challenging, but there's nothing more rewarding. So no, you don't have to go back to work and climb the corporate ladder. You can do that anytime you like, but your child is only so little for so long.
Your book sounds super fascinating. We would love to have you on when it's ready.
Yes, I'll keep working. I'm halfway through. It's pretty snarky. I'm having to go through and edit it and edit my tone a little bit. I'm like, I'm so passionate about it. I really, really, I can't. When I hear about people saying like, yeah, I did the cry it out method, I'm like, oh, so you're a monster. You're a child.
Yeah, I remember when my mom came here, we were building what's the next room to our a baby room. He says, oh, you got a baby room like Western. He says, have you seen any, look outside the animals, any animals put the kids somewhere else and they sleep somewhere else? They always make sure best place near in the room so we can feel breathing, feeling the love and all of that. Says, this is putting room, closing the door, let them cry today. This is horrible, and it's gonna affect the babies for the rest of their life. Just being close, and you don't have to sleep next to them, but enough that at least aware of their feeling, what they're doing, and that's an enjoyment, at the same time. So yeah, you have to learn. You have to learn in this culture that take the times and invest in postpartum times for moms and parents to be off. If you look at Europe, I mean, they really, it pays off to have, and at the end, you have more successful society. You have a better outcome, and they pay to stay instead of society have to put everybody in jail. Well, thank you very much. We really
totally
enjoyed this.
Agree.
Yeah, we enjoyed that. Rob, do you have anything else?
Just want to ask, how can our listeners find you?
So if you want to be a patient through my concierge practice, you would find me at resultspsychiatry.com. That's RESULT psychiatry, PSYCHIATRY.com. Or you can find me through United Medical Doctors if you wanted to instead go through insurance. So either way, you can catch me.
Wonderful.
Happy to serve.
And it sounds like you'll be out in the public domain here soon with your book. So
I hope so. Maybe I'll be on Joe Rogan, and maybe I'll be at Barnes and Noble, but I don't know.
A lot of these ideas,
but either way, at least I get my opinion out there.
A lot of these ideas, these traditional beliefs are coming back. You're seeing, meditation, yoga, traditional diets, all this stuff. I think you're going to really be successful with this book, because all this stuff is coming back. We're recognizing how far we've departed.
Thank you.
So I really commend you.
we need to go back to our roots.
Yeah.
Just
Thank
basic.
you. Let's go back to the roots. Go back to the roots. Yeah, no, definitely. I mean, the new way is not always the right way, but it would also help if we could get that Tesla robot out soon. That would help a lot with everything. So thank you again for having me.
Thank you so much.
Anytime.